Welcome to Conversations on Healthcare. We share two viewpoints on the post-midterm impact on health policy. Former CMS Administrator Don Berwick and Jim Capretta of the American Enterprise Institute. Now, here are your hosts, Mark Masselli and Margaret Flinter.
Roughly 112 million Americans voted in the recent midterm elections, and the candidates and issues they voted on will have profound implication for healthcare policy in the states, at the national level, and ultimately in all of our lives. We're following up on our series called Healthcare on the Ballot, with the discussion focused in on the results and what they mean.
And our guests today are Dr. Donald Berwick, who helped shape the Affordable Care Act during the Obama administration, and the co-founder and president emeritus of the Institute for Healthcare Improvement. Also joining us today is Jim Capretta, a senior fellow with the American Enterprise Institute. He is also the author of a new book, U.S. Health Policy and Market Reforms.
Well, welcome to both of you joining us here today on Conversations on Healthcare. And let's start with a question to each of you. It was widely predicted that the midterms would really trim the sails on the Biden administration's plan for Democrats in the states, and yet the Democrats hold a majority in the Senate, are barely in the minority in the House, and saw many wins for their governors and state lawmakers. What is your view of how these surprising results will influence health policy in the next 2 years? And let's ask Dr. Berwick to respond first and then go to James.
I sure have no crystal ball. We still have a problem passing legislation, given that the House is going to be in Republican hands. I suspect the elections signal that there's some public will for some moderation in this highly polarized climate that we're in. I think people want action. They know there are problems. They've appeared relatively intolerant of people taking very, very extreme positions. So I hope, against hope perhaps, that this means that there'll be some opportunity for some progress kind of in the center for things that everyone cares about. Everyone's very worried about drug prices. Everyone knows that the Medicare Trust Fund is threatened. Everyone knows that there are people left out of the system now who need to be included. And so, I'm hopeful there'll be some progress. The Biden administration did pass some very, very important legislation during the past couple of years. And I also suspect that the positive benefits of some of that legislation will become more apparent to people, as the Affordable Care Act has been, and there'll be some more wind in the sails of some of the reforms that we need. But who knows? Yeah,
some of those policies come in effect in January, so we'll see if they come to fruition as they plan. James, your thoughts?
Well, I think the secret of the 2021-2022 term, which I think might carry into 2023 and 2024, is that there was a pretty big group of senators, bipartisan group of senators in the Senate, that got a fair amount of legislation through to President Biden. And they wanted to make clear to the country that they thought a working Senate was very important, a working Congress is very important. And they're not going to pass legislation that is highly partisan from even a Democratic point of view, I think. Mm-hmm. So something like the Inflation Reduction Act, which passed only with Democratic votes, wouldn't happen this time around. But the things in the middle still could pass. Things that are bite-sized, that bipartisan can get some bipartisan support could still pass. Things like mental health improvements, substance abuse questions, improvements even to the FDA and CDC. Those are possibilities even in this new Congress that's coming in. I think the big action might be in some of the states, actually, as you sort of hinted at with your question. A lot of states are still with lots of Democratic governors, Democratic representation. So many initiatives like the public option plans, trying to do price limitations on certain providers and drugs. Some of that action could shift to the states.
Well, Jim, you're certainly well aware, and we appreciate your pointing out some of those areas where there does actually seem to be some agreement in the country. Hard not to have it on the crisis, mental health, substance abuse, and where we might see some agreement. But Dr. Berwick, you are a veteran of many Washington battles, and I know we still have Congress's lame duck session to tackle. The thing it always surprises me is when I see that we're set for something like a decrease in Medicare payments in all providers, looking at a 4% cut unless Congress acts. We hear Medicare so often talked about as the third rail, something that you can't touch. What do you think is going to happen in that arena this year?
During the lame duck?
Yeah.
I'm not sure. The lame duck hasn't got many breaths left, but I think some of the problems you cited, the payment cuts will have to be, I think they'll be moderated. I don't think that anything dramatic is going to happen in a lame duck to cut back on payments. I think that there is some work that needs to be done to make sure that people have the coverage that they need, and perhaps we're going to see some of that. But as Jim said, I think a lot is going to shift to the states in terms of innovations. For example, I would watch not necessarily during the lame duck, but over the next year or two, Medicaid waivers as an area of very interesting variation and novelty among states. There's some real will to get that done, and perhaps the administration then will be able through its administrative authorities to allow more variation among states and trying to do some creative things with financing.
Jim, let's stick with Medicare. Your book makes the case for what you call a vigorous and properly structured competition in healthcare that could deliver the same benefits seen elsewhere in the economy. In an ideal world, what do you think Congress should do about this Medicare payment reduction issue? Let it stand or make some modifications?
Well, I think the payment reductions that are scheduled to happen here in the next few weeks, if something isn't done, I think those need to be addressed and probably lessened. I don't know if they need to be gotten rid of altogether, but some moderation of what's expected probably is in order, especially with inflation running at 7%. You have physician practices paying out a lot of expenses. And if their fees also get cut, you're going to have a real, pressure point building there that I think probably won't be sustainable. So just to get through the next few months, they probably should do something there. Having said that, I think over the long run, as your question indicates, they need to kind of take a step back. Medicare's HI trust fund is expected to be depleted in 5 years or so. They need to kind of step back and look at the whole program, how to structure it better, simplify it, make the benefits more uniform and standardized, and improve how beneficiaries interact with the program.
Mm-hmm. Dr. Burke, maybe I can pick up on what you were just referencing a moment ago as we talk about innovation in Medicare, and you were commenting that the states might actually be looking to do some real innovations in Medicaid through waivers. Would you like to highlight one or two states where you see some really interesting proposals there that you think might really move us forward in a positive direction around Medicaid reform?
Yeah, Maryland's always interesting to watch. They're continuing to try to tweak and adjust their all-payer model. My own state, Massachusetts, now is implementing a massive Medicaid waiver that I think is going to be highly significant. Very important to watch it as we try to move, give an opportunity to move resources to social influences on health, which really is the secret here. If we can find a way to move money where health can be preserved, we may see some progress against our deteriorating health status. California is interesting. I think we're going to have it in Oregon would be good. And there are some Midwestern states that I think to watch here. This may not just be an all blue move in Medicaid reform. I'd say the basic reforms to watch are ones that move us toward global budgets and consolidated payment, allowing people that give care to use resources to meet many more kinds of needs of patients in Medicaid instead of just continuing to run a repair shop. That's what I've got my eye on right now. I hope all of that can happen at the federal level. Whether we see there are some early steps. For example, in the ACO REACH program, there's a pretty dramatic change. It's small and it may not have immediate impact, but the willingness of Medicare to pay plans just a little bit extra for entering areas of deprivation, of geographic areas of deprivation. It's probably not enough to influence behavior much, but it's the first chink in payment that might allow us to move some payment toward social deprivation indices as a way to allocate resources. I must say the other thing that I've got my eye on, but not much hope, is I as Jim knows, I am very critical of where Medicare Advantage has gone now. I think it's a tremendous problem. It's an enormous subsidy going to private insurers now without equivalent benefit at all. And I don't think the administration will have the political chips to take that on yet, if ever, but there's an awful lot of reform needed there, and I just wish it would happen.
Yeah, I think you're right on that. That Mass 1115 waiver, certainly one we're keeping an eye on. Jim, perhaps one of the silver linings, if you will, from the pandemic has been really the loosening of regulations that have resulted in the greater use of telehealth. And Americans in rural parts of the country have really embraced greater access to healthcare. It wasn't necessarily on your list earlier, but it has certainly had been a benefit for accessing specialists. And yet the flexibility authorized during COVID-19 public health emergency will expire soon. We're not really sure if it's soon. There's one version, it could end up in mid-January, but it looks a little more like April might be the time that this really transpires. Do you see telehealth as part of this push for market reform?
I do. I mean, I don't know if people who are for it would all put on the label of market reformers. I think they probably are just saying it's a good, maybe potential supplement to existing ways of trying to help patients. And there's bipartisan interest in it. Now, honestly, I think if there is a spending deal here in the before the end of the year, before the holidays, I wouldn't be at all surprised if telehealth, some fix in telehealth is put in independently of the public health emergency to allow it to continue for a couple more years, get a real evaluation done of it. There are some concerns about just sort of adding on another service on top of other services without really making substitution and cutting costs. So, there's a little bit of question about what it does over time and how it affects patients' health. I would bet that Congress will authorize it if they get the opportunity. There'd be bipartisan support for that. Give it a couple of years and have an independent evaluation to see what it's doing to patient outcomes.
And certainly on the ground, we're certainly seeing telehealth as something that contributes to access, especially in that all-important area of behavioral health, and now maybe some better ways to make it more available for substance abuse treatment as well. So we certainly are keeping an eye on that. And maybe a little bit outside the policy realm, but what will captivate the public's attention and has in many ways over the past 2 years, what is upcoming. We hear Republican leaders really want to subpoena Dr. Anthony Fauci, bring him forward for hearings in the House, and also talk of hearings about federal waste in the COVID relief programs. Dr. Berwick, you certainly went before Congress many times when you were running the Centers for Medicare and Medicaid Services. Do you think these hearings actually serve a role and might be a way of continuing to educate the country about what the entire COVID pandemic and response was about? Are they needed or not so much?
We certainly need a period of national reflection on what we learned from COVID about preparedness, about pandemic response, about public health response, the strength of the public health system, public communication, educating the public. There's a tremendous amount of learning that we need to gather and then map it into policy. I just must say, to take an American hero like Dr. Fauci, who is just as good as it gets, both in science and in public leadership, and subject him to, test to gaming in testimony, it's a waste of time, and I wish they would just give it a rest. But we do need to learn, and hopefully there'll be a period of reflection in Congress and the executive branch about what this tells us about how to be a more prepared country. We were clearly not prepared. Our performance was probably about third worst in the world, and we didn't have to lose 1 million Americans to this disease. We got to be smarter than that. The other preparedness, I can't help mentioning this, is the recent attacks on the grid are not trivial matters. This is as dire a threat for this country as the public health emergency was in COVID. We are definitely not prepared there, and I hope Congress is going to take this extremely seriously. And it would be not just a health issue, but certainly a health issue if we can't secure our grid. Well,
it is certainly important. We've heard from so many guests that this isn't the last pandemic that we're going to face, so we really need to be prepared. Whatever we find out, we simply need to improve our response. Jim, of course, Dr. Berwick was a key architect of what we know as Obamacare. And we saw some interesting election results in South Dakota, where voters approved a ballot measure to expand the state's Medicaid program under the Affordable Care Act, opening up coverage to additional 40,000 residents. But we also saw that earlier, 2 years earlier, in Oklahoma and Arkansas, very conservative states. I wonder, is the fight against Obamacare really over? And if so, what does it mean for the future of market reforms that you advocate for?
Well, I mean, I do think that the question of Medicaid expansion is largely settled. And the reason is that the Affordable Care Act sort of set up a structure where it's easy now for a state to be presented with a yes or no question. You either expand Medicaid according to the ACA's stipulations, or it's going to be very difficult for you to get coverage to that population because you can't undo the rest of the structure of the ACA and go in a wholly different direction. So given that the ACA is in place, has been for over a decade, and the only way to get coverage to that very vulnerable population below the poverty line is to provide Medicaid coverage at this point, then yeah, I think that states are wise to just take it because you're not going to get coverage to that population in any other way. So they should adopt it. But remember, when President Obama passed the Affordable Care Act, he called it a market-based reform. Remember, it's competition on the exchanges. It's choice amongst private plans. It's a Medicaid expansion to be sure, but its central feature was competition amongst insurance plans on the exchanges for the individual market. So in some ways, it is a market reform. And the question for America is how to make our very complicated, fragmented, uncoordinated, and not so well-designed system of public and private work a little bit better together.
Well, that's a very useful perspective, Jim, and thank you for pointing that out. And I just a question that maybe both of you would like to respond to, but Dr. Berwick, let me start with you. Whether it's in the exam room or town halls or legislative assemblies, few things get people talking like drug prices and the need to lower drug prices. And you've noted that there are actions President Biden could take now to lower drug prices, including the most favored nation's drug pricing for a number of drugs paid by Medicare. Take us through your thinking on the topic about what needs to be done in this area. And Jim would welcome your comment after Dr. Berwick as well.
It's a very bad problem and continuing to worsen mostly. It's not one problem, though. Their drug prices depends on which tier of drugs we're talking about. At the high end of the extremely expensive biologics and biosimilars, we are seeing very, very little discipline exercised by the companies themselves, and the market forces are not working. I'd love to hear Jim's comments about it. I can't wait to read his book. But I'm personally seeing no alternative but some very aggressive administrative pricing of drugs. I just don't see a way to get that under control. The prices are obscene, and they don't have rationale in my book. In the middle ground, I think competition can do a lot. I think Part D, remember, came in a lot cheaper than anyone thought it would, right. And I think that there is room for competition. To do that, you have to be able to open up competition. There are some patent laws that need to be changed. There's some awful stories around the defects in the drug patent laws that allow capture of medications as old as the pyramids and then enormous high pricing. I'm also a fan of some of the new stuff that's going on in competition in the generic market. I was an advisor to Civica RX, which is a very, very interesting move by healthcare providers to make their own drugs. And I suspect we might see some more of that. So it's not one size fits all. I am a fan of Medicare negotiating prices, but we have yet to see really whether that's going to work. And I'm going to follow the changes in the recent legislation with great interest as kind of an early try at whether that using that market power can help. But I say the lack of discipline is shocking. And in fact, the nearly fraudulent or nearly not quite illegal activities around drug pricing need to be brought under control. We need stronger authorities. There are some FDA reforms that would help. I hope there's some bipartisan thought about that because we are a little slow in terms of helping important drugs emerge, and I'd be happy to see that happen as well.
Jim?
Well, my perspective basically is that inevitably in the drug space and the drug pricing space, you're balancing two conflicting objectives, which is you want research and innovation to bring new products into the market that are better therapeutics than what is currently available. At the same time, you want to make all of the therapeutics priced at a level that they're affordable and accessible for the whole country, everybody equally. And those are difficult to reconcile. And I think the big missing piece here is really a much more vigorous and publicly run and publicly initiated effort to figure out which drugs coming online are actually valuable and which ones aren't. So if we have things coming online with very high and elevated prices that don't deliver therapeutic benefits above what the previous standard of care is, they shouldn't be priced high. The big part is deciding what is the clinical value of a new product. And I think we could do a much better job of identifying that. Frankly, Germany does a better job than we do in that regard, and trying to price according to value rather than just letting the drug companies decide what the value is. So there should be a much more public effort, my view is, around identifying those things that are coming online that really are beneficial and those things that are not. And the things that are not, they should be priced at the generic level.
I'm also wondering about another need that I'd love to hear Jim's thought about at some point. There actually is not an awful lot of correlation between what might call the social need for a drug, that if you could pick the top 10 drugs to create, what would they be? And the research investments in being induced by the current market forces or whatever forces are there. I'm wondering if there's a possible policy initiative which would change that, which would sweeten interest in producing the drugs which we need most for the health of the public, and maybe by contrast, decrease interest in the others. I've not explored that to the extent I want to, but I think that would be a very interesting avenue of policy research.
Well, in that spirit of the season, we want to end on a positive note. You are both very accomplished and terrific advocates for your perspective. And where do you see the opportunity for progressives and conservatives that come together in 2023 on healthcare issues?
There should be bipartisan interest in a strong public health infrastructure. It doesn't matter how you vote, you're going to pay the price if we don't have one. And that's got to be government. There's no private sector public health defense. We did talk about drugs. I think we're all worried about it. We have different solutions. My solutions are certainly different from Jim's, but we're concerned enough. We ought to find our way to some answers. The mental health and substance misuse, misuse arena is desperate, killing tens of thousands of Americans. And we have not yet formulated strong public policy on that. And I think we probably could find a bipartisan route there. On markets and the ACA, we will continue to disagree. I don't have much faith that market solutions are going to be the ones that work. But then again, I haven't studied Jim's book yet, so maybe I'll change my mind.
Well, I think on this question of mental health and substance abuse, it's really, bordering on really a crisis in the United States at this point.
Oh, yeah.
And it really needs to be attended to by both parties because it's affecting so many aspects of our society. And I think there is great interest in both parties and being just much more aggressive in putting together a national strategy to really get the problems that are out there a little bit better under control and directed and treated. And so I'm hopeful that it could be one big area where there could be a lot of bipartisan agreement and movement. And then on these other things, some of them are by necessity. They're going to have to do Medicare probably on a bipartisan basis because neither party probably has enough kind of political capital to do it on its own.
That's
so
right.
Some Medicare solvency will probably be bipartisan. I wouldn't anticipate that right away, but over time, that'll probably happen.
When all else fails, bipartisanship possibly may win the day. Thank you both, Don and Jim, for joining us today, for sharing your insights, for your work. And thank you to our audience for joining us. You can learn more about conversations on healthcare and sign up to keep updated with hearing from us at chcradio.com. Thank you so much. Best wishes to both of you.
Yeah.
Thanks. Happy
Thank
holidays
you guys.
to you all.
Same to you
Thank
as
you.
well.
Happy holidays.
All righty.
Thank
Take
you.
care.